Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Very interesting questions. One question was about vitamin D, and there's a lot of confusion about vitamin D out there. I can tell you from my practice, so regardless of what anybody says, we like to see the vitamin D levels be between, this is vitamin D3, between 40 and 50. If you start getting your vitamin D level up really high, from my experience, you just may have some other issues with calcium metabolism problem. I use 2 drops of Demulsion Forte on my tongue every day. If you start taking vitamin D and you notice that your skin starts to itch, especially when you're walking or jogging 2 miles into the jog, you may have a calcium deficiency. So I'm just throwing that out there to you. And if you have leg cramps at night, everybody's body is different. Below 30 is an issue. I notice individuals with darker skin have vitamin D levels under 20. You don't want too low of a vitamin D. It will impair your immune system. Someone wants to know the cause of deep grooves running up and down the middle of the fingernail. Usually ridges are caused by adrenal gland stress. Moon-shaped nails are usually anemia. Peeling nails are usually a digestive problem. So in this particular case with the ridges, it's very possible. It could be adrenal. You may have had a very massive stress situation. Dr. Bob, I'm writing from Calgary, Canada, and I've been taking statins and I've had severe muscle pain. They wanted to know what to do. I want you to know that one of the bad effects of a statin drug is muscle pain. You want to know what to do about that. Well, I can tell you Dr. Bob's ABCs, half a red apple every day, a third cup of beet fiber, and a medium carrot has the potential to lower your cholesterol up to 40%. We do use a product in our practice called tocotrienol. You could contact us. A lot of times elevated cholesterol is due to low thyroid and stress. I don't have a license today to get off the statin, but I would think about that. Someone wanted to know about a GE reverse osmosis unit versus a Kinetico. I used to have a Kinetico. I now use a GE. I chose the GE because the service for it is closer. The Kinetico service is about an hour and a half away. We've had great results with the GE. I don't have any preference over one or the other. You can look on the internet. There'll be a lot of different opinions. The most logical to do, if you whatever kind of RO unit you have, is get a test kit and just test your water, because everybody's municipal water comes from a different source. I want you to know that RO water usually takes 10 or 12 gallons of regular tap water to make 1 gallon of RO water. Dr. Bob, I have a very unusual question. My body skin, when it's exposed to white bed sheets at night, it leaves a purple stain. So this is probably one of the most unusual questions I ever have had. And first, you mentioned that you're taking chlorella. You've used turmeric, used some different sprays. I even contacted a detail person about this, wanted to know what they thought, and we use a product called 3GB, which I thought was interesting. It's a choline-based B vitamin. I would consider making sure that your liver is okay. I really don't know enough about you. I would definitely be drinking enough water. You also mentioned something about that you do a lot of more raw. I'm not totally into raw food. I'm into combinations of steamed, cooked, and sauteed. I wish I could give you a little bit more of an answer to this. It'd be interesting to do maybe some testing. We maybe even consider hair analysis, saliva testing. We do have a test called the organics test, which is an assessment of your urine. We see more and more xylene toxicity right now. That just kind of came to me, and you might consider looking into that. One of the terms for that is chromohydrosis. Do a little search on that. Dr. Bob, is there anything equal to the medication Arimidex? Well, first, I don't have a license to take you off a medication. Basically, what that product does is helps minimize the amount of estrogen inside of a woman's body. We actually use a product, and I take it myself, called Chrisin. You want to eat broccoli. There is a urine test that you can do called an Estronex urine to see your good and your bad estrogen level inside of your body, which I'd encourage you to do. I'd eat more broccoli. Chrisin is the name of the product that we use. Dr. Bob, I had cancer, type 2 diabetes in 2010. and you're trying to lose some weight and lower your diabetes. Well, you need to exercise. You mentioned something about the fact that you eat raw food also. I am into mid-glycemic foods. We talk about this in Dr. Bob's Guide to Optimal Health. I would use a combination of sauteed and cooked vegetables also. You want minimal blood sugar spikes. I would focus on some avocados and almonds, and make sure you're exercising. Last question. Dr. Bob, what is the safest cookware to use? Well, I want you to know in our household we primarily use stainless steel. Cuisinart and All-Clad are the products that we typically use. In the past, we've also used copper bottom pans. Wow, a lot of wonderful questions. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob.